Hi, I'm Greg Halliday. I'm a cardiology PA and I work here at Intermountain Health. When I was a kid, I grew up wanting to be an Egyptologist, actually, and so I really started studying about that kind of stuff, and then I realized I'm probably not going to make any money in this and or be at home at all. And growing up, my dad worked 3 jobs, and so I really just kind of went around thinking, you know, what can I do with the kind of education that I like to have a good job, help people out. I had a microbiology professor who was the kind of the pre-PA advisor, and we had a few conversations about that, and I'm like, that sounds really amazing, actually. Cardiology is great. I've been in it for 18 years now, and it's been great. Cardiology it's a really fun. It's a really nice specialty. Unfortunately, cardiovascular disease is very common in humans, but it makes it really easy to study. So we have millions upon millions of people that we can study, and I think a lot of the data that we get and a lot of the research we get will help people live longer, better. I think that's what I'm most excited for, just ongoing, more in-depth research to help people just not have the symptoms and not develop these problems in the first place. When I go in to see a patient, the first thing I usually ask, now if you watch this video and you see this and I don't say this, I usually say, how can I help? And I really mean that, and I really want people to understand that we are here to help. We're not here to push a med, or we're not here to just make a goal. We're here to make improvements in people's lives. Relationships are critical because there has to be trust both ways. There has to be a trust with the patient that I'm going to do the best that I know how, make good recommendations that are based in science, based in data. The biggest thing that I expect a patient to want to do is to do their best to maintain discipline. Because regardless of the recommendations that I make and the meds that we say to take, the largest part of the outcome that the patient is going to achieve is going to be based on how willing they are to maintain discipline, to either take a medication, but more so just the changes in lifestyle, diet, exercise, and those things are hard. I would like all my patients to understand that we really are here to help. We want to be open, we want to be caring, we want to understand what the patient's needs are, what they're looking for, what the perspective is, what their expectations are, but we really are here to help. It's why we went into medicine. If without that, it's just a job, but we're really here to help.